Live, late breaking. WESH 2 News Sunrise on CW18 starts now.
Last week, Today Show weatherman and co-host Al Roker revealed he was diagnosed with prostate cancer. And it's shining a light on just how important it is to get screened early. This morning, Dr. B is back with us to talk about the process and what to look out for. So first of all, Dr. B, thanks for being here this morning.
Good morning.
Good morning. So we want to look at Al Roker's case. Can you explain how he would have gotten a diagnosis?
Yeah, Al Roker is the ideal guy that we want to diagnose early. He's 66. He's in the demographic that if we find prostate cancer early, we can potentially cure them and he can live a normal life expectancy. This is how it probably happened. He probably got a lab test done, which is a simple blood test called a PSA, which then triggered a red flag in his doctor's eyes, which then led to him actually getting an imaging test, an MRI, which we always didn't used to do like 10, 15 years ago. But that imaging test essentially confirmed what the PSA was showing is that, hey, there's some warning signs. He eventually probably got a biopsy of his prostate, which then led to the confirmation and diagnosis of prostate cancer.
Well, I'm glad you brought up the MRI, because is an MRI a common thing used now to help with diagnosing prostate cancer?
It doesn't help in diagnosing prostate cancer, but it definitely helps us get to a diagnosis, I would say, much more effectively. It's basically like GPS mapping of the prostate. And what we do with the MRI images is we basically fuse them when we're doing the biopsy. So even the littlest spots that the radiologist may say are abnormal on the MRI, we can actually find when we're doing these biopsies. In the past, biopsies used to be like us looking for cancer, like a needle in a haystack, but now we can actually get down to almost the exact pinpoint location that there are these suspicious spots. So it's definitely a game changer. Not everyone needs an MRI, not everyone gets an MRI, but it's a really cool technology that we can use to do a much better job in diagnosing the right patients.
Right, it's a good tool to help, essentially. Are these technologies available here in Central Florida?
Absolutely, absolutely. I've done about 10 MRI fusion prostate biopsies this month alone. Absolutely, almost all of our facilities here have that technology available. But again, it's less about the technology and more about using Al Roker to get people in. Go and get your initial blood test with your primary care doctor, or come and see us as urologists. We can figure out what the technology is appropriate for you afterwards, but get yourself screened. Hopefully we've inspired a few people with this diagnosis.
Right, and I know that was a lot of Al Roker's messaging there too. What is Al Roker's prognosis, do you think?
You know, I'm not his doctor. I don't have his records, but it looks like he's going to be getting a robotic prostatectomy, which is, for a young guy like him, young healthy guy, I would say the best option, where we just take the prostate out surgically. If he has low-grade cancer, which it seems like based on what I'm hearing, he has a normal life expectancy. He can live, he has a 99% chance of living over 15 years. So life expectancy is pretty good. What's also cool is not everyone needs treatment for prostate cancer. There's actually something called active surveillance, which we can do. And there's even radiation as an option. So not everyone needs surgery. Not everyone needs radiation. Not everyone needs intervention. So don't be afraid that if you get diagnosed, you're going to have surgery or some aggressive interventions. A lot of our guys actually don't need anything. We just watch the cancer.
All right, some great information there, Dr. B. Thank you so much for joining us this morning. And of course, the end-all be-all message here is to make sure that you get screened, because that's so important. Dr. B, thanks so much for being with us.
Thank you.